the impact of COVID-19 and government lockdown on children's schooling, time use, and marriage timing in rural Bangladesh. So Professor Abu Shonchoi of Florida International University is going to present.
So this is a joint work with Momoy Makino from Institute of Developing Economics in ID Jethro, who is currently in Population Council, and Professor Jackie Wahas of University of Kent. And what we wanted to do in this paper is trying to understand the impact of COVID on rural children in Bangladesh. So let me tell you a bit about background that why this is an important question. As we know that COVID-19 has kind of made an unprecedented impact on all over the world. However, based on previous research and other studies that we have seen, this impact is disproportionately higher on the poor in developing countries. So when we think about COVID impact on poor, there are predominantly three dimensions of the impact that we can think about. So the first dimension of impact is infection-related vulnerabilities. And there are two main causes of concern here. One is poor typically stay in a very congested and high densely populated areas, so where human-to-human contact is obvious and keeping social distances and other measures would be extremely difficult for the poor. So they get disproportionately more exposed to this kind of conditions. And also, we know that in poor countries, we have insufficient medical facilities and inadequate medical system, and that will also systematically exclude poor to get good medical care during the time of pandemic. The second series of impacts that we can think about during COVID is the lockdown-related vulnerabilities. When the lockdown was imposed, and which was predominantly to reduce the virus spread or to curb the disease resurgence, we have seen a rising number of job loss and return migration to happen. And those of us who study development economics, we know that a large chunk of the poor depend on informal sector for their income, and also there is a big share of this informal labor income is happening in the towns, in the cities, and large metropolitan areas. So when lockdowns happened, many people lost job immediately. Many of those people came back home, and that also created a remittance shock for these families, because these families are quite dependent on remittance flow. And the third impact channel that we can think about, which is the school closure. Many of these poor areas, the schools are completely closed for a considerable amount of time, and the school closure could have multiple pathways to have an impact. One could be learning loss, that the kids completely forget what they have learned, but there are other risks which are school discontinuation risk. Families might consider not to continue the school when the schools will open, and they already have decided with some income generating activities and discontinuing school. And another important channel of impact would be child marriage for girls. And then I'll go into the details of the child marriage risk very soon. So recently, Save the Children has produced a paper on this disproportionately high impact on girls due to the pandemic in their report. And they are very worried that all the advancement that we have done in the last several years, in last 2 decades, might be challenged during the time of COVID. So the literature tells us that the socioeconomic consequences of government lockdown have quite drastic impact during the time of pandemic. So we have some literature talking about the impact during the time of Ebola. Bandera has done fascinating work on that. Meningitis work by Archibong and Anand that shows that during the time of government lockdown in previous episodes of pandemic and epidemics, there was a large impact on girls. Also, papers talk about aggregate shock in developing countries, like when there is a rainfall shock or large aggregate shock, there is impact on children's schooling and marriage outcomes. The Stephen Darkham and Jacoby Scofia's works documented this, and also the recent work by Corno said that, kind of documented the same thing, that during the time of large aggregate shock, girls get affected, their schools get discontinued, and probably will be married off quite sooner to manage this kind of aggregate shock. And there are already established link on economic shocks and gender inequality, and Esther Duflo's work in 2012 documented this channel. So by and large, these studies suggest that disproportionate consequences of lockdown measures following the pandemic among the poor girls. So let me focus on the country-specific scenario, which is Bangladesh. So far, Bangladesh has 434,000 cases of COVID, and Bangladesh is one of the top 25 globally affected countries in the world. So the first case in Bangladesh was detected on March 8th, and then the country quite quickly took measure for lockdown. In Bangladesh, they called it holiday, and that was imposed on March 26th. And the economy reopened on March 31st, and schools are by and large closed. So in rural areas, the schools are closed since March 26th, and the school, as of now, when I'm giving the presentation, there has not been any clear indication when the schools will be open. Now, it has consequence on girls' education and girls' marriage, because from the literature, we know that one of the advancements that we have done to reduce child marriage in countries like Bangladesh, which is girls' education. So when girls go to school and encourage girls to go to school, that has a negative impact on their marriage, early marriage or child marriage consequences. And also Bangladesh and other countries try to create gender parity by encouraging girls' education, by making conditional cash transfer programs, and also providing free schools. So when the schools are closed, it makes girls much more vulnerable, because families now can decide to marry their daughter off earlier, or could start marriage-related discussions, so which could have an impact on school discontinuation for the girls. So in this paper, what we focus is what is the impact of these COVID-related outbreaks on adolescents, age 13 to 17 in Bangladesh. And there are three broad outcomes that we focused here. One is the time used for the children. Second is probability of children's school continuation. And third is incidence of child marriage and marriage-related discussions. So here, the child marriage-related discussion is also quite important, given the fact that in this part of the world, most of the marriages are done under arranged marriage system. So the bride's family and groom's family, they will start conversations, and based on the conversation, there will be marriage happening. So also, collecting data on marriage-related discussions would be very important to know that whether there is an elevated risk during the time of COVID. So to understand this impact, we did a rapid phone survey in one of the rural poorest areas of Bangladesh, which is the North Bangladesh in Gaibandha district. And these surveys were done immediately after the COVID lockdown over phone. So we already had two projects going on in the same district, and we just completed the baseline survey, and then COVID happened. So we thought that since we cannot do our study, why don't we collect data for the COVID impact? And so we repurposed the sample, and we collected the rapid phone data to measure the impact. So I will not go into the details of these two projects that is written in our paper. So basically, there are two projects where we combine the baseline data to create the baseline indicators, and in this, based on this baseline data, we collected the rapid follow-up survey during the time of COVID. So I'll quickly show you some of the summary stats, just to give you a glimpse of the data that we have. So because our existing projects were mainly targeted for female, our sample has a large chunk of female representation. So only 20% of the sample is male in terms of children, and 80% is female. And what is interesting is during the time of the baseline, none of the children were married. And within 2-3 months gap, like from the baseline to the COVID round, we found about 4% girls mostly to be married. So it shows the tendency there, like how likely, how prevalent child marriage is in those areas. So let me tell you about the economic loss or the shock that is happening in these areas. From our survey, we found that about 40% of the sample head of the household lost job during the time of the lockdown. About 61% reported that they are suffering from the decrease in remittance, and about 80% of the households reported a reduction in the food consumption. So this food consumption reduction is either they are cutting down one meal or they are eating less diversified food, and they are really struggling with their day-to-day expenses and food security measures. And we collected time use data on our sample. So we asked these kids that what are their 24 hours look like in a typical day during the lockdown. So we collected data there, and we also have reports on marriage-related discussions, marriage, engagement, all sorts of child marriage-related outcomes. So let me quickly tell you the estimation technique that we have used. For the time use, we just look into the gender dimension, because all the households are receiving similar type of school closure issues. So all these households, kids are in the school. So we just wanted to see whether these girls are disproportionately being exposed to different kind of activities, or they are being discriminated in terms of their education hours and other hours of work that they're doing. And for the COVID-related shock, we created 2 shock variables. One shock variable is health-related shock, whether these households, anybody in the family has been suffering from the health-related shocks or respiratory shock or been hospitalized. We created a Z-score for health shock. And for economic shock, we created a Z-score for job loss, loss in remittance, and return migration related economic shock. And we interacted this economic shock and health shock with the gender dummy, just to create this interaction effect to see whether girls are being disproportionately more affected by this economic shock and health shock by these households. So the first result that I will show is the time use data. We have data on sleep and care for others, household chores, unpaid work, paid work, study and leisure. And if you look into the data, you can clearly see that girls are more engaged in household related activities, household chores and care for others. On the other hand, girls are less likely to be spending time on study. And we also found that girls are being engaged in paid work. So these are like working for other households as like domestic help or in agricultural activities. So more likely to be working in the paid work, less study hours, and as a result, and they are more engaged in caring for other household members and elderly in the household, and disproportionately more compared to the boys. And in the second set of regressions, where we would like to focus on the child marriage and likelihood of school continuation, we asked the household head that whether they would like to continue their child's education. So this is reported in column 1. In column 2, we have information about engagement or marriage, and in the third column, we have marriage-related discussions. So one good news is we did, at least from the reported likelihood of continuing education, we don't see any impact of economic shock or health shock or girl-related dummy, the likelihood of going back to school. So most likely, at least all the parents are reporting that they would like to continue the girls' education, and it's not different. However, if you look at the health shock corrected with the girl dummy, so the health shock impact on marriage and economic shock impact on the marriage, what we found was quite interesting, that economic shock has a negative impact on girls' marriage or marriage-related outcomes. However, economic shock has more incidence of marriage-related discussions to improve. So it shows that those households who got economic shock, they are now engaged in the marriage-related discussions, but not conducting marriage, or in any case, they are reducing the marriage probability. Health shock also shows similar impact on the marriage-related discussions, but no impact on the marriage. Now, this might sound a bit counterintuitive, but in the recent study, even in the Cornell study in 2020, they also found that when economic shock happens, in the dowry-observing societies, marriage gets delayed. There could be a couple of pathways for that. One could be that they need to organize dowry, and because of the economic shock, they cannot organize dowry, so they are postponing the marriage. And also there could be ceremony expenses and other expenses. But given that the marriage has been reduced, but the marriage-related conversation has increased, it shows elevated risk for these girls that as soon as the lockdown will be over and things will normalize, these girls will be victim of child marriage. Similarly, we found that girls are increasing their time spent on caring for others and household chores, but not using time for study relative to boys. So just to conclude, we found that marriage-related discussion has increased due to the adverse shock, and less study hours, greater non-study related activities, and marriage could lead to school discontinuation for the girls. And given that the gender parity in schooling has appeared in most part of the developing world, and it took 15 years to achieve gender parity, if these child marriages are happening and school discontinuation will be triggered due to marriage, we will lose all we have gained in last 15 years for the gender parity. So that's the one-line policy conclusion that Bangladesh and other low, medium-income countries need to consider the gender dimensions more carefully to tackle aggregate shocks like pandemic. So with that, I'd like to finish my discussion. Thank you.
Thank you, Abu. Now let's proceed to Q&A. So you can ask questions and make comments on Abu's paper as well as the other two papers. Okay, let me see. Okay, go ahead.
Can I ask a question on Abu's paper?
Please go.
Yes. Abu, very interesting paper. Just a clarification on discussion. What sort of threshold do you find when you think about discussion? I mean, my own sense is these discussions are always taking place. And could it be that, you know, you've just come in at a particular point of time and you're asking these households, and so they tell you that yeah, they're discussing. So how much is it a real phenomena versus just a discussion that goes on taking place in South Asian communities about marriage? Thank you.
Thanks, Rana. That's a good question. So yes, I mean, we didn't use particular threshold. It was a rapid phone service. We asked whether they are seriously talking about marriage with potential groom's family, and the response was yes and no. And the fact that we found those households where they have received, they got economic shock, they have more tendency of having more marriage-related conversations to happen compared to other households. So it looks like there is a disproportionately more marriage-related conversation happening in those households who are affected due to job loss or economic shock. So that's kind of the takeaway. But I mean, because of the rapid phone survey nature, we couldn't use more nuanced estimates of marriage-related conversation. It was like whether they are seriously talking with someone about marrying their daughter off, and the answer is yes or no.
Right. Thank you.
Can I ask a question?
Please.
Okay, I'm Kazi from Bangladesh. Hi, Sanjay, how are you doing?
Hi. I'm fine. How are you?
Very nice presentation. I'm just wondering, what's the source of economic shock in rural areas in Bangladesh? Because so far we know that the COVID is more of an urban phenomenon in Bangladesh, and the harvest was very good in rural areas. There is no change in wage rate. So I'm just wondering what the source of shock that have impacted the child marriage and other outcomes. That's one question.
Sure.
Question number two is, what's the counterfactual? I mean, this kind of conversation could have happened even in the absence of COVID, right? So how do you draw the causal inference here? Just wondering. Thank you.
Thank you, Kazi. So the source of economic shock is from the migration channel because many of these households have a migrating member working in the urban areas and earning an income. And when the lockdown happened, many of them lost jobs, like those who are working in the garment factories or those who are working in the urban informal sectors. They lost jobs and they came back home. And the shock channel is through the job loss or through the remittance disruptions, not from the rural sources of income. And this part of the area where we have done the study, there is a high propensity of people migrating outside of the Gaibandha and earning some income. That's the shock variable that we have used. And related to the marriage, like counterfactual, yeah, I mean, marriage related, as I think Rana also has the same question. So there are conversations happening all the time, like any given period of time, if the girls are reaching to like age 15 or age 16 or age 17, maybe families are talking about marriages or there are conversations happening. But given the fact that those households where we saw that they are affected due to economic shock and they have more marriages to happen, that kind of fits well with the previous narrative that when economic shock happens, one of the coping strategies for this kind of families is to marry their daughter off, because this is when they would like to think that this could be a coping strategy, that I can marry my daughter off, and then as soon as I can marry that daughter off, I don't have to bear the consequences of paying for the education or higher dowry price if the daughter gets older. So this is what we are observing. I'm not very sure whether I can call it causal, because these are observational study and there is not a clean identification here. So I am not very not very confident to show any causal interpretation here, but these are kind of correlational. Like I can say, like there are a strong correlation that economic shock and marriage related discussions to happen, but not very confident to say this is causal or not.
Many thanks.